What's going on, world? Welcome. Hey, today we are doing NCLEX questions. NCLEX questions. Y'all already know what the deal is. Welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and follow me. Make sure you guys go over there and follow me on Instagram. Follow me on the gram because we don't know what's going on with TikTok. You know what I'm saying? We don't know what's going on with TikTok. Hey, but as you guys start to trickle in here, make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. Okay. Got some NCLEX questions that we're going to go over today. Right. So, of course, I want to know who you are, where you're from, and where you are at in your nursing journey. If you guys are just now joining, my name is Kevin. I go by the Boot Nurse on all social media platforms. I've been a nurse for almost 4 years. I worked ICU, OR, and PACU. I was in the Navy for 16 years, and I'm here to give you all some NCLEX questions today. All right. So, hey, I need 1,000 likes and I need 100 people up in here before we go anywhere. So I'm gonna need for y'all to stop being greedy, coming over here on TikTok, getting all this knowledge, and y'all can't do this for me. You know what I'm saying? Get carpal tunnel, you know what I'm saying? But I want to know who you are. I want to know where you're from, and I want to know where you are, where you're at in your nursing journey. What's up? Hopefully everybody had a really great weekend. What's up? I see y'all starting to trickle in here. What are we doing? What is going on? Taking prereqs at South College. Shout out to you, Betty. Took my NCLEX last week. Hold on, I found out that I failed. I need help. Brenda, first of all, I don't ever want you to think that you're a failure ever in life doing anything, all right? So that's number one. Number two, check your candidate performance report and see where you have the lowest area, right? And then that's where you want to start. So if it's pharmacology, you want to start with pharmacology, okay? So, but if you do need help or if you're looking for anything like that, you can check the link in my bio. I have some stuff over there, free download, also a course, as well as if you need one-on-one, I got you as well. You can check that out. It's in my bio. D, my man, what is the deal? You're welcome, Brenda. Hey, I got 180 something people up in here. I need 1,000 likes. What are we doing? I need 1,000 likes before I go anywhere. I got a whole bunch of questions that's over here that are just like, oh my God, tell me something. But y'all over here being greedy. Give me 1,000 likes and then it's on and popping. It says finish med search 2 in my PN program. Shout out to you, Kaya. Is it Kaya? Kiki. Shout out to you. But hey, if you guys are just now joining, my name is Kevin. Make sure you guys smash that like button. You guys share, you guys follow. Nurse Cass is in the building, y'all. Just like, hey, she works corrections and she will fight you. I've seen it happen. But I want to know who you are, where you're from, and where you are at in your nursing journey. Valletta, hey, how are you? It has been a while. How are you doing? Bet, yeah, you know what's up. Y'all know what's up. Hey, but anyways, like I was saying, I want to know who you are, where you're from, where you're at in your nursing journey. All right, I got some NCLEX questions I want to give y'all. Hey, but I need 1,000 likes. Apparently, nobody wants to give me 1,000 likes. So, I mean, what are we doing? But hey, for a little bit about me, I've been a nurse for almost 4 years. I was in the Navy for 16 years. I've been an instructor for 9 of those 10 years. So I come to TikTok, give me all this love and give you all this knowledge. Kalia says, I'm from Jersey, finished my LPN program 2 weeks ago, but waiting to take the NCLEX. Shout out to you. He's an amazing teacher, and I'm just starting. Hey, shout out to you, Jacoby. Nicole says, hey, I came back like I promised to let you know that I passed my NCLEX. Nicole! Hey, Nicole's number 1 today, y'all. Shout out to Nicole. Congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. Ma'am, if there's a piece of advice that you could give to anybody and everybody that is taking their NCLEX, ma'am, what would it be? And once again, Nicole, congratulations. First of all, I'm going to pin that so that way everybody out there can give you your flowers. All right. But here we go, y'all. Shout out to y'all for being here. Here is our first NCLEX question, all right? A pediatric nurse is performing a routine assessment on a 1-month-old infant during a well baby visit at the primary care clinic. The infant's mother reports no concerns and states that the baby has been feeding well and has had normal or regular bowel movements. Upon assessment, which of the following findings warrant further investigation by the nurse? Select all that apply. So something is wrong that we need to pay attention to. All right. So what exactly would that be? Drop your answers in the comment. Is it A, abdominal respirations, irregular breathing rate, inspiratory grunts, increased heart rate when crying, nasal flaring, cyanosis, or asymmetric chest movement? What are we thinking? Shout out to all 180 of y'all. We are doing NCLEX questions. Rach, what is the deal? How does it feel to be a nurse out there? I see you. I see you. I see you. All right. So shout out to y'all that are here. A, B, C, and E. Okay. All right. All right. Hey, if you guys are just now joining, hey, we are on the road to 10,000 likes. All right. We're on the road to 10,000 likes. All right. Crab Cakes says, I graduate Friday. Shout out to you, Crab Cakes. That's what I'm talking about. All right. We're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, my throat hurts. I'm just saying. I got bronchitis and I ain't worn no shoes or nothing, Jesus. What are we doing? What are we thinking, y'all? What are we thinking? I graduated Thursday. Shout out to you. Yes, I'm an RN now. Thank you for your live free review. Rach, hey, this is what I do. This is what I do. This is what I do. B, C, E, and G. That's Amanda. Rose is telling me A, B, C, E, F. Okay. B, C, E, F, G. All right. Cool. I'll give y'all 10 more seconds. B, C, E, G. Okay. All right. Let us see. All right, y'all. Let's see what the answer is, y'all. Here's our answer. In 3, 2, oops. I lied. Here we go. The answer is C, E, F, and G. All right. C, E, F, and G. Grunting occurs when an infant attempts to maintain an adequate functional residual capacity in the face of poorly compliant lungs by partial glottic closure. As the infant prolongs the expiratory phase against this partially closed glottis, there is a prolonged and increased residual volume that maintains the airway open and also an audible expiratory sound. All right. With nasal flaring, it occurs when the nostrils widen while breathing and is a sign of trouble breathing or respiratory distress. Cyanosis refers to the bluish discoloration of the skin and indicates a decrease in oxygen attached to red blood cells in the bloodstream. And with G, asymmetric chest movement occurs when the abnormal sides of the lungs expand less and lag behind the normal side. That indicates respiratory distress. That is part of health promotions and maintenance. Part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. All right, 6 to 12% on the NCLEX exam. It says, but I thought cyanosis was common finding in newborns. Cyanosis is common findings in babies that are just now being born. So if they were born,
6932.
I don't know what we're talking about.
Food.
Oh, okay.
Paper.
Yeah. So that's something that happens like as part of the APGAR score, right? Remember, this baby is a month old already. All right. The baby is a month old. All right. Here we go. Here we go. So shout out to y'all for getting that right. Hey, make sure when you guys are going through questions, you guys circle back and get the content. All right. You guys circle back and you get the content. All right. But here we go. Question number 2. During her shift in the maternity ward, Nurse Jackson cares for Miss Green, who is at 42 weeks of gestation and shows no signs of labor. Given that the fetus is now considered post-mature, Nurse Jackson recalls the risks associated with post-maturity. Among the following potential complications, which one is primarily linked to the post-mature status of the fetus? Is it excessive fetal weight, low blood sugar levels, depletion of subcutaneous fat, or progressive placental insufficiency? What are we thinking? Everybody's screaming D. Hey, if you guys are just now joining, welcome. We are doing NCLEX questions. Hey, by the way, I got these questions off nurseslabs.com. They're free sets of questions. You guys can go over there and check those out for yourself. But hey, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time we get to question 10, then I guess y'all are only getting 10 questions today. So, I mean, I guess that's just totally up to y'all. All right, what are we thinking? Everybody's telling me D. Everybody is telling me D. By the way, I want to know who you are and where you're from and where you are in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? But the answer is D, progressive placental insufficiency. Post-mature or post-term pregnancy is prolonged and exceeds the limits of 38 to 42 weeks. All right, infants of such gestation are considered post-mature or dysmature if there is evidence that placental insufficiency has occurred and interfered with fetal growth. It occurs in 12% of all pregnancies. The placenta loses its adequacy to function after 42 weeks. after which it acquires calcium deposits, which decrease the blood perfusion supply of oxygen and nutrients to the fetus. All right, that's part of health promotions and maintenance. Health promotions and maintenance, which is 6 to 12% on the NCLEX exam. LPNs, you guys learn the same exact content that RNs learn. You guys learn the same exact content that RNs learn. It's all about scope of practice. That's what separates it, right? There's things that you can and can't do and cannot and can accept. You need to understand what those are. So shout out to everybody that got that question right. I started in the ICU May 13th. I intern there now, but still RN. Yay. Yes, absolutely. 5 months left to my BSN. Shout out to you, Kim. BSN studying for the NCLEX. That's what I love to see. Last we talked, I was struggling to pass my HESI. I passed that NCLEX in June. That's what I'm talking about. That's what I'm talking about. Shout out to you. Congratulations. Here we go. Question number 3. In the post-surgical unit, the nurse is attending to a client who had a total hip replacement 7 days ago. 7 days ago. This client has a history of hypertension, mild asthma, and is on anticoagulant therapy. The client provides feedback about their current condition. Which of the following statements by the client is most concerning and necessitates the nurse's immediate intervention? So what is something that garners my attention right here and right now? Something that is not normal, something that is unexpected. All right. I have bad muscle cramps in my lower leg of the affected extremity. I just can't catch my breath over the past few minutes, and I think I'm in grave danger. I have to use the bedpan to pass my water at least every 1 to 2 hours. It's tiring, or it seems that the pain medication is not working as well today. I'm scared. What are we thinking? Remember, Maslow's, all right? Maslow's. It never goes away, ladies and gentlemen. It never goes away. Physical versus psychosocial, right? You got to think about those ABCs, right? It says what? It says, if it ain't B, then I'm cooked. Alyssa, yeah, you might be. You just might be. Hey, welcome, everybody. Welcome. We're on the road to 10,000 likes. If you guys are just now joining, make sure you guys smash that like button. You guys share and you guys follow. I got these questions off nurseslabs.com. They are free sets of questions. Free sets of questions. What's up, Katie? How are you? I'm doing well. Hope you're doing well yourself. Hilda, I appreciate you. Thank you. Here we go. Here's our answer. I got my hands on Mark Clemick lectures and notes. Are these good study tools? Mark Clemick is the greatest, one of, if not the greatest of all time to have ever done it. Does his stuff help? Absolutely. But you're going to need more than that. You're going to need more than that. So find yourself some good questions. You can either use Archer, you can use UWorld. I have an NCLEX course as well. That's linked in my bio. So you're going to need more than just Mark Clemick. But here we go. But the answer is B. I can't catch my breath over the past few minutes, and I think I'm in grave danger. So, Alyssa, look, you ain't cooked. At least not yet. No, I'm just playing. But here we go. The nurse would be concerned about all of these comments. However, the most life-threatening is option B. Clients who had hip or knee surgery are at risk, higher risk, for the development of post-operative pulmonary embolism. Sudden dyspnea and tachycardia are classic findings of pulmonary embolism. Without prophylactics, such as anticoagulation medications, deep vein thrombosis can develop within 7 to 14 days following the surgery and can lead to pulmonary embolism. All right, the nurse should be aware of the other signs of DVT, which include pain and tenderness at or below the area of the clot, skin discoloration, swelling, or tightness of the affected leg. All right, signs of pulmonary embolism include acute onset of dyspnea, tachycardia, confusion, and pleuritic chest pain. That's part of reduction of risk potential. Reduction of risk potential, which is the fourth largest section on the NCLEX at 9 to 15%. LPNs, you guys have the same test plan, all right? Same content. The only thing that's relatively different is coordinating care versus management of care that is for RNs, but you learn the same exact content. Hey, if y'all ain't smashing that like button and if you ain't following me, what are you really doing? Be my friend. All right, stop playing games. And if you don't understand that ABCs, Maslow's, all right, you have to understand those things when you guys go in to take this test, okay? So don't be that individual. Here we go. Number 4, in the cardiac unit, a nurse closely monitors a 33-year-old male client diagnosed with heart failure. Cool. Heart failure. Paint the picture. Okay. The client, a previously active triathlete, was recently started on furosemide due to increased fluid retention. The client mentions a few changes he noticed over the past week. Which of the following statements by the client would suggest that he may be experiencing a negative side effect of the furosemide? Keyword in this sentence is negative. All right, it's negative. So I was surprised to see my weight jump up by 5 pounds in just a few days. I've noticed my swelling. I've noticed some swelling around my ankles by the end of the day. My stomach has been feeling upset lately, especially after I take the pills. Or I haven't been as hungry this past week, even for my favorite food. What are we thinking? Shout out to all 100 plus 100, almost 200 y'all. Appreciate you. Furosemide would cause you to lose water weight. You are very correct, right? So, but what else does it do? What else does furosemide do? Remember, it's a loop what? All right, it's a K what? What happens when I have too much K, not enough K? This is the NCLEX wants you have to use your critical thinking in order for you to make a clinical judgment. That is what the NCLEX test plan says. If you don't believe me, you can go look it up, but I'm pretty sure most of y'all don't even want to go to that website, right? So critical thinking, that's what you have to think about. Then you have to think about what are the signs and symptoms that come with, maybe a low K, right? Think about those things. Yeah, I'm dropping gems right now. Stop playing games with me, all right? Here we go. What are we thinking? We got B's, we got C's, we got D's, we got A's. Everybody's all over the place, all right? Oh, we're all over the place. But here we go. Let's see what the answer is. Let us see what the answer is in 3, 2, and the answer is D. All right. I haven't been as hungry this past week, even for my favorite foods. Now let's read it. Now, a lot of y'all are about to be mad. You're like, why, Kevin? Why? Well, that's why we read rationale. Stop playing games with me. All right, here we go. Furosemide is a loop diuretic that is used for pulmonary edema, edema in heart failure, nephrotic syndrome, and hypertension. Furosemide causes potassium loss unless a supplement or a potassium-rich diet is taken. A decrease in appetite is caused by hypokalemia. Oh, look at that, right? Signs and symptoms of hypokalemia include anorexia, fatigue, nausea, decreased GI motility, muscle weakness, dysrhythmias, reduced urine osmolality, and altered level of consciousness. Nah, yeah, some of y'all are just like, oh my God, Kevin, you're such a liar. Look, stop playing games with me, all right? Pharmacological and parenteral therapies, all right? Pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. Gotta read the question fully and look into exactly what it's at. Exactly. RTFQ. As I say all the time, hey, for my frequent flyers, let people know in the chat what RTFQ means, all right? And if there's something that you don't understand, trust me, go back and look at it. Go back and look at it, all right? Pharmacology is gonna be there. Trust and believe me, all right? I don't need y'all going out here making no crazy medical mistakes with these meds, all right? It's not a game and it's not a joke because the boards will take that license. Trust and believe me. All right, here we go. Question number 5. A 32-year-old pregnant woman comes to the clinic for her prenatal visit. The nurse gathers data about her obstetric history, which includes 3-year-old twins at home, a miscarriage, and a miscarriage 10 years ago at 12 weeks gestation. How would the nurse accurately document this information? Fill in the blank, all right? So I want to know what the gravida and I want to know what the para is. Read the question. Katie, you know it means more than that. Stop playing. But yeah, you know what's up. Shout out to y'all. Hey, shout out to all 250 y'all. We are doing NCLEX questions. By the way, I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. I got 3 and 1, 3 and 2, 3 and 2, 3 and 1. Okay. 3 and 2. Okay. Oh, look, we have the general consensus that is 3, right? Gravida, right? Twins count as 1. Oh, all right. Okay. Let them know. Let them know. All right, here we go. Let's see. Let us see what the answer is. All right. Let us see what the answer is in 3, 2. And the answer is gravida 3, para 1, or G3P1. Gravida is the number of confirmed pregnancies. And each pregnancy is only counted one time, even if the pregnancy was a multiple gestation, i.e. twins, triplets, etc. Para or parity indicates the number of pregnancies that have reached viability, so 20 weeks, regardless of whether the infants were born alive. Thus, for this woman, she is now pregnant, had 2 prior pregnancies and 1 viable birth, which is with the twins, okay? Health promotions and maintenance. health promotions and maintenance, which is 6 to 12% on the NCLEX exam. All right. 6 to 12% on the NCLEX exam. Hey, this is part of maternal health. All right. If you're not familiar with maternal health, I suggest that you go back and you do a little bit of digging in some maternal health. All right. Maternal health was a tough spot for me. Right. And so I recommend you go back and you start looking at that, right? What's up, Tiffany? How are you? Hey, but real quick, hey, I got some test taking tips over there to help y'all conquer the NCLEX. It's a free download right over there on my website, thebootnurse.com/test. First of all, stop playing games with me, all right? It's free, all right? It's free, Free. Like the state of Jones, right? Free. Go over there and check it out. Hey, it's 42 pages, y'all. 42 pages. What's up, Morgan? How are you? All right, hey, the only thing that you don't get over there is this fanny pack, all right? Go get your own. Stop playing games. By the way, get a fanny pack. All right, by the way, also, I am doing a 3-day NCLEX review. All right, this coming Friday, it's going to be live. We're going to be going over NGN stuff. We're going to be breaking the NCLEX style questions down, and I'm going to go over the 8 client needs sections. All right, you get my victory guide, you get my course, and you get to be part of the community. You guys can check that out. That is also linked in my bio. All right, here we go. Here we go. In a wound care clinic, Nurse Palmer, like Kiki Palmer, is assigned to Miss Harris, a 27-year-old female client with a history of deep vein thrombosis. Ms. Harris presents with a venous stasis ulcer on her left lower leg, which has persisted for the last 3 months despite home care efforts. All right. Ms. Harris has been managing the ulcer with the over-the-counter dressings and is concerned about the lack of progress. She has also mentioned that she has been feeling fatigue lately and has unintentionally lost 5 kilograms over the past month. Based on the assessment and the client's history, which nursing intervention would be most effective in promoting the healing of an ulcer? Think about it. All right. Apply dressing using sterile technique, improve the client's nutritional status, initiate limb compression therapy, or begin, the prolytic debridement. What are we thinking? Shout out to all 197 of y'all out here. We are doing NCLEX questions. Make sure you guys go over there and check out nurseslabs.com. This is where I got these questions. All right. Free sets of questions. You guys can go over there and check them out for yourself. All right. Here we go. We got some Morgan's telling me C. Got a few people's telling me B. Morgan, what you laughing for? High protein diet increases wound healing. Okay, Liz. Okay. Here we go. I feel kind of bad because I know I'm talking a lot and I'm pretty sure a bunch of people are just like, hey, shut up. Well, you can go away. Hey, free shit is free shit, my guy. Here we go. But the answer indeed is B, improve the client's nutritional status. All right. Venous status occurs when venous blood collects and stagnates in the lower leg due to incompetent venous valves. Eventually, little oxygen and nutrients are supplied to the cells of the lower extremity, causing the cells to die or necrose. This ultimately leads to the formation of venous stasis ulcers, characterized by shallow or by shallow but large brown wounds with irregular margins that typically develop on the lower leg or ankle. That's part of basic care and comfort. All right, basic care and comfort, which is 6 to 12% on the NCLEX exam. This is foundations, ladies and gentlemen. All right, basic care and comfort is part of foundations. All right, it's something that we learn when we first get to nursing school. You can't forget semester number 1, all right? Because it's going to come right back around, part of NCLEX, all right? So make sure when you guys are doing this that you go back, get your content, and then you jump forward, keep doing your questions, and you have to read your rationales. Liz, I passed my NCLEX. First of all, ma'am, congratulations to you, all right? That's number 1. Number 2, I'm going to pin that right now because I want everybody to give her flowers right now. Everybody right now, give Liz all the love right now and let her know that you're proud of her. And I'm proud of you too, Liz. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to all 130 folks up in here, ma'am, what would it be? And once again, congratulations to you. Welcome to nursing. It's great. It's glorious. Let me tell you. Here we go. Question number 7. Who said that? Was that Cash? Thank you for the heart. I appreciate you. It says, thank you and you world. Oh, thanks to you and you world. Stop it. You could have just said me. No, I'm just playing. But I appreciate you. All right. Here we go. Question number 7. Nurse Jackson has recently taken a role of nurse manager for a busy medical surgical unit. She wants to implement an effective feedback or reward feedback system to improve team performance and foster professional growth. During a team meeting, she discussed potential strategies for feedback. Which of these statements a team member makes best describe the characteristics of an effective reward feedback system? All right. Is it we should provide specific feedback immediately after a task is complete or observed? Everyone should get feedback. All right. Both good and bad in equal amounts, regardless of individual performance. Always begin with compliments before providing any constructive criticism, or we should set performance expectations so high that only a few can reach them. AKA, what could you have done better? Because, hey, heaven forbid, you do something right and the nurse manager comes to you like, hey, yeah, that's great, but what could you have done better? Because that's how they be coming. What are we thinking? What are we thinking? Shout out to all 117 of y'all. We are doing NCLEX questions. Hey, a little bit about me. If you are new here, I have been a nurse for almost 4 years. I worked ICU, OR, and PACU. I also was in the Navy for 16 years. Oh, and by the way, I also failed my NCLEX 3 times. And here I am. So, ladies and gentlemen, for those that are scared to take this exam or those that were unsuccessful at taking this exam, what you scared of? What you scared of? Don't be scared of it. All right? In order for you to get better, I truly believe in order for you to get better at anything, you have to fail. All right? Failing allows for you to see where you did wrong and how you can improve upon it. All right? That's the only way that we get better. Hey, if you're feeling that, smash that like button. Make sure you guys share, you guys follow. All right? But here we go. The answer is A. All right, we should provide specific feedback immediately after a task is completed or observed. All right, feedback is most useful when given immediately. Positive feedback is strengthened through immediate feedback and is easier to modify problem behaviors if the standards are clearly understood. That's health promotions and maintenance. All right, 6 to 12% on the NCLEX exam. So shout out to everybody that got that right. If you got it wrong, circle back, get the content. All right. I think I'm question fatigued. Did a Kaplan Cat and a final today. I can't read anymore. Then take a break. Hey, take a break. It's okay for you to take a break. It's a part of the process, all right? It is 100% a part of the process. There is a thing called, there is a thing of overstudying, right? And we don't want you to overstudy. All right, here we go. Question number 8. Nurse Martinez is caring for Mr. Reyes, a 45-year-old client newly diagnosed with multiple sclerosis. Mr. Reyes is an active individual and has voiced concerns about how this diagnosis will affect his fitness regimen. During a teaching session about safe exercises and physical activities for MS patients, Nurse Martinez provides various recommendations. She later evaluates Mr. Reyes' understanding of the information provided. The nurse determines that the client needs additional information or an additional teaching if Mr. Reyes makes which of the following statements. Select all that apply. What do we think it is? All right. So Mr. Reyes has multiple sclerosis. All right. Let's think about what the signs and symptoms of somebody who have MS. All right. And now what did he say that does not coincide or that does not go with someone who has MS? All right. I am glad to hear that I can still incorporate weightlifting and resistance training into my regimen. I believe it's essential to push myself in exercise to the point of exhaustion to stay fit. It's reassuring that I can still engage in aerobic exercises like brisk walking or cycling. It's crucial to ensure proper stretching and warm up exercises before starting my exercises or my routine, or for best results, I assume I should exercise without taking any breaks, right? All right. B and E, A, B, and E. All right, cool. B and W. Well, if W was on here, cool. I would agree, but it ain't there. Oh, okay. I got you. Here we go. A, B, E, A, B, E. All right, cool. Let's see what the answer is. Megan's in the building. What's up, Megan? All right, y'all. Here we go. Here's our answer in 3, 2. And the answer is B and E. All right. Bravo and Echo. All right, so here we go. Patients with multiple sclerosis should not exercise to the point of fatigue, as strenuous physical exercise raises body temperature and may agitate symptoms. It's essential to exercise, but not to the point of exhaustion. All right, and with answer choice E, continuous exercise with no rest period is contraindicated for patients with multiple sclerosis who want to exercise. Actually, for anybody, like take a break. The patient should be advised to take short rest periods, preferably lying down. Again, extreme fatigue may contribute to the exacerbation of the symptoms. That's health promotion and maintenance, which is 6 to 12% on the NCLEX exam. All right. If you got it wrong, that's okay. Remember, NCLEX was select all that applies now. Partial credit. It's part of the partial credit. All right. So make sure if you don't know an answer, do not pick it. All right. If you don't know the answer in a select all that apply, don't pick it. All right. But shout out to you. He says, I'm thankful for this live. Morgan, I'm thankful for you being here. I love it. All right. As long as if I can reach one person, which I know I reach more than that, but if I can reach one person for them to do better, hey, that's all I care about. Here we go. Question number 9. Nurse Anderson is visiting the home of Mrs. Thompson, an 80-year-old woman with advanced Alzheimer's disease. Mrs. Thompson's family, including her daughter and son-in-law, have been primary caregivers and made several modifications to accommodate her needs. Nurse Anderson, assessing the quality of home care provided to Mrs. Thompson, seeks to prioritize the safety and well-being of the patient. During her evaluation, which statement made by the daughter will the nurse reinforce as being of utmost importance? Kiko, what's up? What's up? What's up? Kiko Suave. All right, so what do we think it is, right? Which one of the statements does the nurse reinforce of being the most important thing, all right, when it comes to somebody with Alzheimer's, all right? What do we think it is? It's only one, by the way. It's only one. It's not a select all that apply. All right, everybody scream and C. Understanding the risks, we've installed safety bars in the bathroom and set up a 24-hour alarm on all exit doors to prevent wandering. Okay. April is telling me B. We've been attending a support group discussion every week at our community center. It helps us cope and learn from others. Now, what's the most important thing when it comes to somebody who has Alzheimer's disease? There you go, Keisha. Safety, right? Safety. So what is the utmost importance? It indeed is the safety of the patient. All right. We have safety bars installed in the bathroom and have 24-hour alarms on the doors. Note all options are correct. However, safety is the most important to reinforce. All right. So shout out to y'all for getting it right. Remember, y'all, you got to read the question. You have to RTFQ. You got to read the question. So Alzheimer's, all right, dementia, they like to get up, they like to wander, they're older, they can't see. We don't want trip hazards. We got to make sure that we get rid of all those issues for them. RTFQ, let them know. All right, here we go. Question number 10. A nurse is reviewing a patient's medication during shift change. Which of the following medications would be contraindicated if the patient were pregnant? Select all that apply. Listen, which one of these medications can we not give to a pregnant woman? All right, AKA black box warning. All right, we cannot give it to them. What do we think it is? A. Okay, A. All right, hey, remember, select all that apply. So it could either be one, it could be a few, or it could be all of them. Damn farm, exactly. Which one can it be? I'll give you guys 10 more seconds. What are we thinking? A, C, and E? Okay. Keisha, it's okay. It's all good. It's all good. Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. And if you're new here, I want to know who you are, where you are from, and where you are at in your nursing journey. But the answer is A and B. So warfarin Coumadin, right? Or finasteride. All right, finasteride. Now let's see. Both of them, these are part of pharmacological and parenteral therapies. All right, the second largest section on the NCLEX exam at 13 to 19%. All right, now with warfarin, right, has a pregnancy category X and associated with central nervous system defects, spontaneous abortions, stillborns, prematurity, hemorrhage, and ocular defects when given any time during pregnancy, and fetal warfarin syndrome when given during the first trimester. All right. And with finasteride, all right, it's also pregnancy category X, right, which has a high risk of causing permanent damage to the fetus. Remember, pharmacological, parenteral therapies. Pharmacological and parenteral therapies. All right. Make sure you guys understand. You guys follow that. When you guys are looking at the maternal health, they go through those important things, those important medications. All right. You're welcome. You're welcome. No problem. Here we go. Hey, once again, hey, if you're new here or if you're not new here or whatever, if you want something free, go over there and check it out. Test taking tips to conquer the NCLEX. 42 pages, y'all. That's an ebook that I just gave y'all for free. All right. Check it out. thebootnurse.com/test. The only thing that you don't get is the fanny pack. I'm just keeping it all the way real. All right, keeping it all the way real. So make sure you guys go over there and check that out for yourself. By the way, I am doing a live NCLEX review this Friday, Saturday, and Sunday. You're going to be with me all weekend. First of all, isn't it glorious? All right. Hey, I'm going to be doing a 3-day live lectures. I'm going to be going over the new the new generation NCLEX, breaking down NCLEX questions based off of the NCLEX test plan, talking about strategies on how you answer the questions, right? Did a lightning round, right? You guys get access to my 7-day course, which has 80 videos in it. You also get access to my NCLEX community where I go in at least once or twice a week and I do live question breakdown, and I also do lectures. So you guys can check that out. That link is also in my bio. All right, here we go. Question number 11, Kiko Suave. I'll probably do the boot camp when I'm ready to test. Shout out to you. It'll be there. Here we go. Question number 11, a 68-year-old female patient recently diagnosed with Parkinson's disease and rheumatoid arthritis tells you during a follow-up visit that her urine is starting to look discolored. She also mentions that she has been taking over-the-counter medications for constipation and occasional headaches given her medical history and the potential side effect of the medication, which of the following of the patient's medications is least likely to cause urine discoloration. Least, all right? What do we think? Is it sulfasalazine, levodopa? What is it? Phenolphthalein? Yeah, phenolphthalein. Or is it aspirin? Acetylsalicylic acid. Hey, try saying that like a million times fast. Acetylsalicylic acid. All right. Hey, if you guys are just now joining, welcome. We are doing NCLEX questions. I got them off of nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check those out for yourself. Hey, make sure you guys and share. All right. Like and share. All right. Because that is the TikTok trifecta. All right. To get to the For You page. You know what I'm saying? Hey, I know TikTok may be going away, but hey, they ain't gone yet. So we still got to utilize them to the best of our abilities, right? Hey, still got to utilize them, all right? What do we think? Everybody's telling me B. No, somebody told me D, and somebody told me C. All right, princess. All right, let's see. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is D. It is aspirin. Aspirin is not known to cause discoloration of the urine. Side effects and complications of taking aspirin include stroke caused by a burst vessel. The Food and Drug Administration doesn't recommend aspirin therapy for the prevention of heart attack in people who haven't already had a heart attack, stroke, or any other cardiovascular condition. Essentially, what it's saying is that aspirin does not cause your urine to change color. All right, that's part of pharmacological and parenteral therapies. Which is the second largest section on the NCLEX exam at 13 to 19%. Hey, there's a running theme here. You're going to get pharmacology questions. You're going to get management of care questions. You're going to get physiological adaptation type questions, which include medical emergencies. You're going to get them. All right. So you got to prepare for them. All right. So shout out to y'all for getting that right. And if you didn't, circle back and get the content. All right. Here we go. Question number 12. You are a charge nurse responsible for reviewing the nursing unit's refrigerator at a busy urban hospital that has recently experienced a power outage. The outage lasted for a short period, but you're ensuring that all medications are stored correctly post outage. During your review, you find several medications, some of which are critical for patients with chronic conditions. Which of the following drugs, if found inside the fridge, should be removed and replaced due to incorrect storage? All right. So something don't belong in there. Which one of these medications do not belong in the refrigerator? Which one? Shout out to all 71 of y'all. Hey, if you guys are new here, I am Kevin. I go by the Boot Nurse on all social media platforms. I've been a nurse for almost 4 years. June 5th will be my my 4-year anniversary. I worked ICU, specifically in a burn ICU and a medical ICU. I've worked PACU as well, and I also worked in the operating room. All right. I was in the Navy for 16 years. 9 of those 16 years, I was an instructor, a master instructor, and I took NCLEX 3 times and I passed on the 4th. So for all my people that are taking NCLEX, hey, I love y'all. I'm just letting y'all know. If you fail the NCLEX, I love you even more. You know what I'm saying? Because you can't be giving up out here. If you can give up on yourself, you'll give up on your patient. Trust and believe me when I tell you that. So don't give up on yourself. Don't tell me you want to be a nurse and it's been your dream and you're not going to work hard enough for it to be a reality. You know what I'm saying? So shout out to y'all. Make sure y'all y'all got to put in this work. But the answer is Corgar or Nadolol, right? It is a beta blocker used to treat high blood pressure and angina. It does not require refrigeration and should be stored at room temperature away from heat, moisture, and light. That's part of pharmacological and parenteral therapies. No, it was not a select all that apply. It did not say select all that apply at the end of the question, sir. It did not. But pharmacological and parenteral therapies is 13 to 19%. Today is my last day of nursing school. Thank you for doing these lives. Now time for this NCLEX. Dawn, hey, last day of class. Shout out to you. First of all, congratulations on getting through nursing school. I need for y'all to realize that nursing school, the endurance of even getting in and then going through it, in reality, I promise you, is a lot harder than the actual NCLEX. All right. A lot harder than actual NCLEX. All right. So for the fact that you got through it, congratulations to you. Now you're almost there. You're almost there. Do not stop before the finish line. All right. Here we go. Question 13. A 34-year-old female who is a renowned biologist specializing in immunology has recently been diagnosed with an autoimmune disease. During a consultation, she discussed her concerns with the nurse, mentioning her recent discovery of being pregnant. She expresses her worries about the potential impact of her condition on the fetus and is curious about the body's natural protective mechanisms. Which of the following immunoglobulins should the nurse explain as the only one that will provide protection to the fetus in the womb? Is it AGA, AGD, AGE, or AGG? Which one do we think? Tweedledee. Tweedledee. Oh, I'm sorry. I couldn't help myself. Is it Amios? Amios is telling me C. Katie's telling me C. Is it Mabelita? Mabelita? What did you say? Told me D. Shout out to you. All right, here we go. Is it Mabelita or Mabelita? I don't even know. Correct me, please. I want to make sure I'm saying your name correctly. Mostly for the ones that I know how to say. All right, y'all, here we go. Here we go. All right, we got some C's in the building. We got some people saying D. All right, here we go. Here's our answer in 3, 2, and the answer is D. All right, it's IgG. All right, is the only immunoglobulin that can cross the placental barrier. About 70 to 80% of the immunoglobulin in the blood are IgG. Specific IgG antibodies are produced during an initial infection or other antigen exposure, rising a few weeks after it begins, then decreasing and stabilizing. The body retains a catalog of IgG antibodies that can be rapidly reproduced whenever exposed to the same pathogen. IgG antibodies form the basis of long-term protection against microorganisms. That's also part of pharmacological and parenteral therapies. Mabelita, thank you for the roses. I appreciate you. Pharmacological parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. Does not matter. Ladies and gentlemen, if you are RN or LPN, you guys learn the same content. All right, LPNs, there's certain things you can and can't do and cannot and can accept. All right, you need to understand the scope of practice. All right, understand the scope of practice. I don't care what you do in the real world. I don't care what your state tells you. This is a national exam. All right, national exam. So NCLEX perfect NCLEX hospital. All right, here we go. Question number 14. A second-year nursing student who is on a clinical rotation in the infectious disease unit of a major urban hospital has just suffered a needle stick injury. The incident occurred while the student was assisting in drawing blood from a patient known to have a high viral load and is positive for AIDS. Okay, the student is visibly shaken, as they should be, as they are aware of the patient's medical history. Which of the following is the most significant action that the nursing student should take immediately after the incident? A, damn, right? Immediately call a social worker to discuss potential implications. B, start prophylactic AZT treatment as soon as possible. C, start prophylactic, pentamidine treatment to prevent potential optimistic infection. Seek counseling to address potential emotional and psychological impact. Report the incident to the clinical instructor and fill out an incident report. Or seek immediate testing for HIV to establish a baseline. What are we thinking? What are we thinking? All right, we got some B's, we got some E's. Amios is telling me E. Liz is also telling me E. User 61 is telling me C. Okay. All right, so let's read. Hey, what is the most important thing to do immediately? I mean, right after. Report, then test. All right, well, let's see. Let me give you guys 10 more seconds. Hey, if you guys are just now joining, we're on the road to 20,000 likes. 20,000 likes. Make sure you guys smash that like button, you guys share, and you guys follow. All right. So, and I also want to know, if you're new here, who are you? What are you doing here? Where are you in your nursing journey? And if you're not a nurse, what are you doing here rocking with us? All right, here we go. Let us see. Let us see what the answer is. Here's our answer in 3, 2, and the answer is B. Start prophylactic AZT treatment as soon as possible. I don't even know how to say that, so I'm not going to say it. So that AZT treatment is the most crucial or critical intervention. It is an antiretroviral medication used to prevent and treat HIV/AIDS by reducing the replication of the virus. Post-exposure prophylactics for HIV is a treatment to suppress the virus and prevent infection after exposure. PEP should be taken within 72 hours of post-exposure to HIV, so it is important to seek treatment quickly. While reporting the incident, seeking counseling and other actions are also important. The immediate priority is to reduce the risk of HIV transmission. All right, HIV transmission. That's part of safety and infection control. Safety and infection control, which is 10 to 16%. All right, 10 to 16%. On the NCLEX exam. All right. Hey, that's like number 5. That's the 5th largest section. That's number 5. All right. So you got to understand. When you get stuck, you got to get on that med. You got to get on those meds. Okay. You have got to get on those meds. So shout out to y'all for getting that right. If you didn't get it right, circle back. All right. Remember, go back to the book. All right. And when in doubt, go back to the book. All right. So shout out to y'all. Here we go. Question number 15. A 35-year-old male who is a professional marathon runner has been an insulin-dependent diabetic for 5 years. He visits the clinic expressing concerns about recent changes in his training performance. He mentions fatigue, occasional dizziness, and now an inability to urinate for the past 24 hours. Which of the following complications of diabetes would you most likely suspect? Is it atherosclerosis, diabetic nephropathy, right? Autonomic neuropathy, somatic neuropathy. Oh my God, diabetic retinopathy, or hypoglycemia. Man, remember, it's not a select all that apply. It is not a select all that apply. All right, we got everybody screaming B. Hopefully everybody had a really good weekend. All right. Make sure everybody's safe out there. You know what I'm saying? Hopefully, hey, graduation is right around the corner for a lot of y'all. So I'm proud of every single one of y'all. And y'all are going to go out there and take NCLEX. Hey, the month of May and June and July are going to be busy for y'all and for me. All right. So I appreciate y'all being here. But here we go. Here's our answer in 3, 2. And the answer is C. It's autonomic neuropathy. Autonomic neuropathy affects the autonomic nerves, which control the bladder, intestinal tract, and genitals, among other organisms. Paralysis of the bladder is a common symptom of this type of neuropathy as manifested by bladder urgency and inability to start urination. That is part of physiological adaptation, this is the first time this one popped up. All right. The third largest section on the NCLEX exam, at 11 to 17%. Ambios is like lard. Hey, but this is okay. If you got it wrong, I would rather you get it wrong here. You see what I'm saying? I would rather you get it wrong here. Go back, and understand the content and then tackle it again. Not the same one, but keep pushing forward. All right. That's the way the rationales allow for you to retain the information that you're out here learning. Okay. So here we go. Shout out to y'all for got it right. If you got it wrong, you know what to do. All right. Hey, once again, I got some test taking tips that are over there for you guys to help you conquer the NCLEX. 42 pages. Everything but the kitchen sink, and that fanny pack that I got on. So I'm just saying, go over there and check that out. Free download, bootnurse.com/test. Also, not to forget, I'm doing a live NCLEX review May 3rd to May 5th. By the way, I'm also doing one May 17th to May 19th. So there's a wait list for that. You can check that out. That link is also in the link tree in my bio. So even if you don't need it, share it to people, because as soon as this live is over, I'm going to be passing out information, and the first people to be a part of that are going to get the information for it. All right. So make sure you guys go over there and check that out as well. Here we go. Question number 16. You are conducting a health assessment in a high school clinic. A 14-year-old girl who is a lead ballet dancer in her school's performing arts program comes in for a routine checkup. She has a BMI of 18 and appears fatigued. During the assessment, she hesitantly discloses her inability to eat, occasionally induced vomiting after meals, and severe constipation. She also mentions increased pressure to maintain a certain physique for her upcoming performance. Which of the following conditions would you most likely suspect? What do we think it is? What do we think it is? Everybody screaming C. Jordan's in the building. Jordan's telling me C. All right. Hey, if you guys are just now joining, welcome. We are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. All right. And if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. All right. All right. Let's see, y'all. Let's see what the answer. Somebody's saying B. Oh. But then everybody else is, I got a bunch of B's and a bunch of C. Well, let's see what the answer is. Here we go. And the answer is B. Wow. Let us see why. Anorexia nervosa is an eating disorder characterized by weight loss, difficulty maintaining an appropriate body weight for height, age, and stature, and in many individuals, a distorted body image. The girl's BMI is 18, all right? Inability to eat, induced vomiting, and the context of pressure from her ballet performance strongly suggest anorexia nervosa, while bulimia also involves episodes of overeating following by purging. The girl's low BMI and inability to eat align more closely with anorexia. The other options are less consistent with the presented symptoms and context as part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right, this is why it's important that you have to listen to those key terms and those cues. On NCLEX, they have categories where it talks about recognizing cues, right? You have to recognize the signs and symptoms that are given to you. Those are your cues to tell you what the disease process is. Man, I'm late today. I forgot it was Monday. Jenny, come on, Jenny. You can't be doing me like that. It's all good, Jenny. You're here. That's all that matters, right? So remember, you got to recognize those cues. You have to recognize those cues. All right. So shout out to you for getting it right. If you got it wrong, circle back. Make sure you understand the difference between bulimia and anorexia. Okay. Here we go. Question number 17. A 24-year-old female who recently returned from a mountaineering expedition is admitted to the emergency department presenting with confusion. The patient's medical record indicates a history of myeloma diagnosis. She also reports having experienced constipation, intense abdominal pain, and polyuria during her expedition. She mentions that she had limited access to water and relied heavily on packaged foods during her trip. Which of the following conditions would you most likely suspect? What do we think it is, y'all? What do we think it is? Shout out to all 103 of y'all. We are doing NCLEX questions. I got these off of nurseslabs.com. They are free sets of questions. You guys go over there and check those out for yourself. And if you're new here, smash that like button. It doesn't matter if you're new here or not. Everybody smash that like button and share and you follow. Stop being greedy out here. All right. And I want to know who you are and where you're from and where you are at in your nursing journey. What are we thinking? Kiko Suave is telling me hyponatremia. Okay. All right, let's see. Let us see what that answer is. Let us see what that answer is. All right. D. Let's see. Wait, did you say natremia? I mean hypernatremia. Okay. All right, well, let's see. Here we go. Here's our answer in 3, 2. And the answer is hyper, but not natremia. Hypercalcemia. All right. Hypercalcemia. All right. Is characterized by elevated calcium levels in the blood. Myeloma can lead to bone destruction, which releases calcium into the bloodstream. The symptoms of hypercalcemia include confusion, polyuria, constipation, and abdominal pain, all of which the patient is experiencing, while the other options might be considered given certain aspects of her presentation. The combination of her myeloma diagnosis and the specific symptoms she's exhibiting make hypercalcemia the most likely suspect. Boo! I'm sorry. It's not my fault. I didn't write them. Here we go. With physiological adaptation, 11 to 17% on the NCLEX, making that the third largest section on the NCLEX exam. Hey, get me to 20,000 likes. What are we doing? Give me the 20,000 likes. You have summer brain. Is that even a thing? I know what pregnancy brain is, but I don't know about summer brain. What are we doing? I'm so glad I'm here today. I am not doing well. And that's okay, though. That's okay, because guess what? You still getting the knowledge in, and that's what matters. All right, here we go. Here we go. Question 18, a 28-year-old woman in her second pregnancy, right, visits the prenatal clinic. During her first pregnancy, she did not receive any postnatal RhoGAM shots. Her medical records indicate that she is Rh negative, all right? The father of the child, however, is Rh positive. Which circumstances would RhoGAM most likely be administered to the mother to prevent hemolytic disease in the infant? All right, when the mother is Rh positive and the infant is Rh positive, mom is Rh positive, baby is Rh negative, mom is Rh negative, baby's Rh positive, mom is Rh negative, baby's Rh negative. Both the mother and the infant have an unknown Rh status, or the mother has previously received RhoGAM in a prior pregnancy. What do we think? What do we think? Shout out to all 160 plus of y'all. We're out here doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and find and check those out for yourself. Amanda's screaming C at me. All right, Amanda. Golly. Everybody's telling me C. I miss Michael Jackson, y'all. I'm sorry. All right, y'all. What are we thinking? I'm going to give you guys 10 more seconds. 10 more seconds. I just had a question on my test just like this. Look at that. Look at that. Here we go, y'all. Here's our answer. Here it says, this was on my test and my exam. Look at that. Here we go. And the answer is C, when the mother is Rh negative and the infant is Rh positive. All right, RhoGAM is given to Rh negative mothers to prevent the development of antibodies against Rh positive blood. This is crucial when a Rh negative mother has an Rh positive infant, as the mother's body might see the baby's Rh positive red blood cells as foreign and develop antibodies against it, leading to hemolytic disease in the infant. RhoGAM is administered to prevent this immune response. That is part of pharmacological and parenteral therapies, which is the second largest section on either NCLEX exam, RN or PN, at 13 to 19%. Whoa, Sharita. Shout out to Sharita. Hey, look at that, y'all. Sharita. Let them know. First of all, Sharita used my 7-day NCLEX course over when I did a 7-day trial, and she rocked it. So shout out to you, Sharita. First of all, Welcome to the greatest shit show on earth, known as being a nurse. All right, if there's a piece of advice that you could give anybody out here, ma'am, what would it be? And once again, congratulations to you. Tell everybody out here, hey, I need all y'all to be giving her love right now. All of y'all need to be giving her love. There's 160 plus of y'all. I need to see these comments flooded with Sharita name on it. All right, here we go. But Sharita, let them know. Let them know. All right, here we go. Question number 19. Question number 19. All right, a 50-year-old patient who is blind and deaf has recently undergone a major abdominal surgery, has been admitted to your post-operative floor. All right. The patient has a history of anxiety and has been on medication for the same. As the charge nurse, considering the client's sensory deficit, recent surgery, and psychological background, what should be your priority responsibility for this patient? All right. Is it let others know about the patient's deficit, communicate with your supervisor, your patient's safety concerns, continuously update the patient on the social environment, provide a secure environment for the patient, all right, arrange for specialized communication tools or interpreters to facilitate patient interaction, or monitor the patient's anxiety levels and liaise with the psychiatrist for potential medication adjustments. What are we thinking? Hey, a little bit about me. If you guys are new here, my name is Kevin. I've been a registered nurse, BSN, if that really, really matters to you. All right, Ashley. God, you got to scream at me, man. But I've been a nurse for 4 years. I worked ICU, OR, and PACU. I was in the Navy for 16 years, and I failed my NCLEX 3 times, and I passed on the 4th. So let me tell you something right now. No hospital, no job, no patient will ever ask you how many times you took your NCLEX. Your NCLEX, your exam does not determine what type of nurse that you will be. Only you will determine what type of nurse that you will be. So, hey, tell all those other people that, you know, they can just go kick rocks somewhere. You know what I'm saying? So Sharita says, hey, here's Sharita's advice right here, y'all. Here we go. Pin that comment. It says, remain focused and selfish with your study time and study test strategies as well. Kevin is the best. Sharita, I appreciate you. Thank you so much for your kind words. Hey, look, I do all this because I do this for y'all, right? But the answer is D. Provide a secure, safe, or secure environment for the patient, all right? This patient's safety is your primary concern. Patient safety protocols can help reduce medical mistakes and prevent adverse patient outcomes. When the goal is to help people, it seems obvious that it's important to work to protect them from unintended or unexpected harm. Given the patient's sensory deficit, recent surgery, and history of anxiety, creating a safe environment becomes paramount, all right? That is safety and infection control. Safety and infection control, all right? Which is 10 to 16% on the NCLEX exam. That's the 5th largest section on the NCLEX exam. Like I said, LPNs, if you're taking your PN exam, you guys learn the same exact content that RNs learn, all right? So get out of your own way. Get out of your own way. All right, here we go. Question number 20. I failed the first time and took the 7-day trial and passed. Sharita, I love to hear that. I love that so much. I'm so happy and I'm so proud of you. All right, now you can go out there and you can do great things. That's one less thing you got to worry about. So, hey, go celebrate. Go celebrate. All right, Nia, I no longer have the trial. The trial is now over. All right, I did it for about it was about 2 months I had a trial and now it's gone. So here we go. Question number 20. A 50-year-old male patient who is a known case of congestive heart failure and was recently diagnosed with osteoarthritis is admitted to the ER. All right. The patient's wife reports that he might have taken an overdose of aspirin in an attempt to manage his pain, his joint pain. Which of the following complications should a nurse most closely monitor for during the acute management of the patient? All right. Is it the onset of pulmonary edema, metabolic alkalosis, respiratory alkalosis, or is it Parkinson's disease type symptoms? What are we thinking? What are we thinking? Dan, can I call you Dan? What did Dan say? Dan said B. Okay. Liz is telling me B. Reese is telling, I'm sorry. She's telling me B. All right. What else are we thinking? Sierra's telling me B. What else? Who else we got? I'm sorry, Reese. I couldn't help myself. I miss Michael Jackson, so that's why I keep doing it. All right, y'all. I'm going to give you... All right, 15 more seconds. What are we doing? What are we thinking? Hey, shout out to all 240 y'all. We're doing NCLEX questions. Hey, we're on the road to 20,000 likes. I don't know what y'all are doing. I'm I'm going to need for y'all to make that happen for me right now. Right now. But here we go. Here's our answer in 3, 2. And the answer is A, the onset of pulmonary edema. Let's read it. I know y'all about to be mad. Hey, first of all, I ain't write these, all right? I got them off nurseslabs.com. They're free sets of questions. Y'all can go over there and check them out for yourself. But let us see what the answer is, all right? Aspirin overdose can lead to metabolic acidosis and cause pulmonary edema development. Early symptoms of aspirin poisoning also include tinnitus, hyperventilation, vomiting, dehydration, and fever. Late signs include drowsiness, bizarre behavior, unsteady walking, and coma. Abnormal breathing caused by aspirin poisoning is usually rapid and deep. Pulmonary edema may be related to an increase in permeability within the capillaries of the lungs, leading to protein leakage and transudation of fluid in both renal and pulmonary tissue. The alteration in renal tubule permeability may lead to a change in colloid osmotic pressure and thus facilitate pulmonary edema, which is pharmacological and parenteral therapies. Whoo, Lord of mercy. It's the second largest section on the NCLEX, y'all, at 13 to 19%. 13 to 19%, all right? You have to understand what these medications do. All right, you got to understand what these medications do. Hold on, y'all, man. TikTok stay want me to verify like Netflix. Are you still there? Bitch, you know I'm here. What you mean? So shout out to y'all for getting that right. If you got it wrong, circle back, get the content. Here we go. Ladies and gentlemen, real quick, test taking tips. Go over there and check them out for yourself, all right? Test taking tips, you get everything plus the kitchen sink, minus that fanny pack. By the way, if you don't get a fanny pack, I don't know what are you doing? All right, get a fanny pack so you don't drop shit all over the floor when you start working in the hospital. Okay, those are those tips to conquer the NCLEX. It's free, 42 pages. thebootnurse.com/test. Check it out. Also, I'm also doing a live NCLEX review this Friday, 3 to 5, from May 3rd to May 5th. So Friday, Saturday, and Sunday. So y'all gets me all weekend. All right, so check that out. We're going to go over the new generation NCLEX. We're going to break down NCLEX style questions. We're going to talk about test taking strategies. You guys get my ebook. You get the 7-day NCLEX course, and you also get to be a part of the community where I do lectures as well. So just took my NCLEX last Friday and passed. That's what I'm talking about. I don't even know what your name is because I just don't know what your name is because I don't know what that is. But shout out to you. Welcome to the greatest shit show on earth known as being a nurse. If there's a piece of advice that you could give to all 130 people that are in here, what would it be? Once again, congratulations to you. I need everybody to be given. I need for y'all to be given that individual. Oh my God. Hey, give that person some love. I'm sorry. I couldn't help myself. But here we go. A 72-year-old patient who is a retired miner. And by miner, you know, somebody that works in a coal mine. I'm sorry, is getting discharged from a skilled nursing facility after a 3-week stay for a lower limb fracture. All right, the patient has a history of severe COPD, likely due to his occupational exposure and PVD. All right, he lives alone in a 2-story house and is primarily concerned about his ability to breathe easily, especially when he needs to climb stairs to his bedroom. Which of the following would be the best instruction for this patient to manage his respiratory challenge? What do we think? We got, what is that? We got C over there. Okay. Is it Maggart 89? He says it's either E or C. Ma'am, you got to give me one. Kiko Suave is telling me... Did I say it right? Just let me know. I'm over here like hooked on phonics trying to figure my life out. Why would you say C or E? I mean, you got to give me one. Maggart. All right, cool. Shout out to all 150 of y'all. We are doing NCLEX questions. We are on the road to 30,000 likes. 30,000 likes. Make sure you guys smash that like button. Hey, you got to give me one. That's your alias? Uh-huh. Sure it is. All right, here we go. Here's our answer, y'all. Here is our answer in 3, 2, and the answer is C. Cough following bronchodilator utilization, all right, for patients. Man, look at that. See? Look at that. Here we go. For a patient with severe COPD, deep breathing techniques can help increase oxygen levels in the blood and improve overall lung function. Whoops. This can be partially beneficial for activities that may exacerbate shortness of breath, such as climbing stairs. While the other options have their merits, deep breathing techniques offer a proactive approach to managing the patient's primary concern about breathing easily. Pharmacological and parenteral therapies. Let's go, Iris. First of all, who is Iris? And shout out to you. Pharmacological and parenteral therapies, which is 13 to 19% on the NCLEX, making it the second largest section on the NCLEX exam. All right. Wait, hold on. Where'd Iris go? Iris, I missed you. I take my NCLEX tomorrow. Iris, you shouldn't even be in here then. I hope you just came in here to tell me that, because I'm finna block you, because you don't need to be up in here. You need to be relaxing as much as possible. But best of luck to you. You don't need luck. You got this. You prepared for it. You got nothing but love over here. Today is Monday. So on Wednesday, I expect for you to come back and let us know that you conquered that exam. I'll be waiting for it. All right, here we go. Question 22. A nurse is assigned to the pediatric cardiology unit where she is caring for a 6-month-old infant. All right, the infant was brought in by concerned parents who noticed that the baby was less active and had difficulty feeding. After a series of tests, the infant has been diagnosed with a congenital heart defect. Which of the following clinical signs would most likely be present and should be closely monitored by the nurse? Is it a slow heart rate, weight gain, decreased systolic pressure, irregular WBC lab values, or is it increased respiratory rate? What are we thinking? Erica said, Erica out here being a negative Nancy. Erica, what we doing? Hold on. It says, I'm not even a nurse and never will be. How do you guys get all these wrong? Erica, first of all, you must be new here. I'm not going to block you and I'm not going to cuss you out, because that's usually what I do. So everybody that comes here is in a different stage in their nursing career. Some people just open their mouth and just said that they wanted to be a nurse. And some people, there's nurses that have been, 20, 30, 40 plus year nurses. You don't see this information often. All right. So most time you see it is when you're preparing for this exam. So number one, be respectful, be nice to everybody up in here. All right. Because we're meeting people where they are. All right. That's number one. Number two, if you try me, I'm going to cuss you out. And I say that with such love and respect. But here we go. Here's our answer, y'all. In 3, 2, here we go. And the answer is B. It is weight gain. It is weight gain. All right. So weight gain due to fluid accumulation is associated with heart failure and congenital heart defect. Heart defect. Okay. Now, when the heart does not circulate blood normally, the kidneys receive less blood and filter less fluid out of circulation into the urine. All right. The extra fluid in circulation or in the circulation buildups in the lungs, the liver, around the eyes, and sometimes in the legs. That's part of physiological adaptation. Physiological adaptation, which is 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. Okay. So if you got it wrong, remember when we're thinking about heart failure and we start, somebody with heart failure, like congenital heart failure, weight gain, edema, they're holding on to fluid. Why? Is because their heart is not able to push the correct amount of fluid out of the body, right? Everything has a balance. All right. Bree says, here, I thought it was E, but A makes so much more sense. I didn't put 2 and 2 together. Look at you. And that's okay though. You have to think edema when we're thinking about heart failure. All right. That's one of the biggest things, right? Think about left-sided heart failure. With left-sided heart failure, we think lung, right? So those are those things that we have to remember. And this is why it's practice. This is why we practice. So shout out to y'all if you got it right. If you got it wrong, that's okay. Circle back and get it right. As long as you're not Erica, because, Erica fucking knows everything. Here we go. Question 23. You are a pediatric nurse in a tertiary care hospital. All right. In a tertiary care hospital. At shift change, you receive a handover about a newborn who was delivered a few hours ago. The mother, a 38-year-old prima gravida, underwent prenatal testing which indicated a high likelihood of Down syndrome, and the diagnosis was confirmed post-delivery. Hey, yeah, look, I'm petty. Don't come over here and play with my people like that. I don't like that. As you prepare to care for the newborn and support the mother, you review the common characteristics of Down syndrome, which are the following characteristics is not typically associated with Down syndrome. All right. And that's the thing. Like you could have people literally can keep their comments to themselves, but a lot of people want to hear and see themselves talk. Like you could have just been like, oh my God, like, how do I get this? Like you could have just not said that. But, you do you, boo. It's not a select all that apply. It's only one. Only one answer. Only one answer. Shout out to all 99 of y'all out here rocking with me. We are doing NCLEX questions. Hey, first of all, we're on the road to 30,000 likes. All right. We're on the road. Autumn is telling, that's my sister's name. Autumn is telling me C. What are we thinking, y'all? What are we thinking? By the way, if you guys are new here, welcome. My name is Kevin. I've been a nurse for 4 years. I was in the Navy for 16. All right. I did 2 deployments, I guess if that makes me cool or not, but probably not. Save yourself the mental health, y'all. But I was a master instructor in the Navy, and I taught in the surgical technology program for 3.5 years. So I've been teaching for quite some time. I love coming over here on TikTok and giving y'all this knowledge. Appreciate y'all answering, but here we go. And the answer is C. All right. Oily skin leading to potential acne in later life. Down syndrome, all right, is associated with a variety of physical characteristics, right? While Simian creases with a brachycephaly and hypotonicity are commonly observed features within individuals with Down syndrome. Oily skin is not typically characterized with this condition. All right. That is part of physiological adaptation. Caroline's like, yes, finally got one. That's all right, Caroline. All right. Celebrate that win. Physiological adaptation, which is the third largest section on the NCLEX exam, at 11 to 17%. 11 to 17%. All right. If you didn't get it right, circle back, get some content, keep tackling those questions. Remember, RTFQ, RTFA, RTFR. Read the fucking questions, read your fucking answers, and read the fucking rationales. All right. If you don't like the F word, I'm sorry. You're going to have a real hard time being a nurse because y'all got some potty mouths. Here we go. Question 24. A client with myocardial infarction is receiving tissue plasmagen activator Actiplace, all right, or Activace TPA. While on the therapy, the nurse plans to prioritize which of the following? Is it observed for neurological changes, monitor for any signs of renal failure, check the food diary, or observe for signs of bleeding? What are we thinking? Oh, y'all quick on this one, huh? Oh, everybody know this answer? I mean, everybody think they know this answer? Everybody's telling me D. All right, y'all, let's see. Let us see what the answer is. This says, good evening. Do you help with T's and hesitate test? I do not help with a hesitate test. I'm assuming you meant HESI. I'm just messing with you. But I do not do help with HESI. Thoughts on Kaplan? I like Kaplan. I use Kaplan when I pass my exam. All right, but here we go. Here's our answer. And our answer is answer choice D. Observe for signs of bleeding. All right, bleeding is the priority concern for a client taking thrombolytic medications. The primary mechanism of all thrombolytics is the conversion of plasminogen to the active form plasmin, right? Which then degrades fibrin. There you go. Pharmacological and parenteral therapies. Second largest section on the NCLEX exam at 13 to 19%. I say these so many times, I get them mixed up and I don't mean to, but I think y'all are picking up what I'm putting down. All right. So, hey, make sure we understand all about our pharmacology. Remember, sometimes it's not about memorization. It's about making yourself familiar. You have to be able to implement them and understand them when I am giving you a certain type of scenario. You need to be able to recognize these cues, okay? Here we go. Question number 25. A nurse is working on the hematology ward and is administering a blood transfusion to a 40-year-old client with chronic anemia due to a genetic condition. The patient, who is a biology teacher, is curious about the physiology of red blood cells, and asks, considering the turnover and production of red blood cells in my body, how long does a typical red blood cell live? Given the patient's background and the context, which of the following responses is accurate? All right. Which one's accurate? Somebody's telling me D and C. Okay, what's C? C says most red blood cells have a lifespan of approximately 90 days before they are replaced. And what was the other one? You said D. You failed your NCLEX? Hey, check out what I got going on inside of the link tree in my bio. What was the other one? The red blood cells generally have a lifespan of 120 days in the body. Man, red blood cells are like some squatters. You can't lie because she knows. What are we talking about? What you mean? Here we go. Here's our answer, y'all. Let us see. Here is our answer. Oh, you can't lie because, yeah. The biologists, they know. They know what's up. And if you, hey, listen, if you meet somebody who has a lot more extensive knowledge than you, first of all, number one, never ever be embarrassed about it. All right, because you don't know everything. And so if you tell them, hey, I don't know, that's a good question, or hey, I don't remember, and that's okay. Because remember, they may know all about that, but when it comes to taking care of you or taking care of them, they're going to be like, please help me, right? Anyway, so the answer is D. The answer is D, all right? D, a red blood cell generally has a lifespan of 120 days in the body, all right? Red blood cells or erythrocytes have a typical lifespan of about 120 days in the body. After this period, they are removed from the circulation and broken down in the spleen and liver. This is why our spleen and liver is important, ladies and gentlemen. The components are then recycled to produce new red blood cells in the bone marrow. This continuous process ensures that the body has an adequate supply of fresh red blood cells to transport oxygen to the tissues. All right, to the tissue. So shout out to all of y'all for getting that question right. If you got it wrong, circle back, understand which does what does what. That way you guys get the questions, you answer the questions better going forward, okay? Once again, ladies and gentlemen, I got some test taking tips over there to help you conquer the NCLEX. Like I said, it's everything that's over there, plus the kitchen sink, minus that fanny pack. If you don't got a fanny pack, what are you doing with your life? Get you a fanny pack. Trust me. When I got a fanny pack, I wore that with pride. And I wish a motherfucker would. Anyways, so it's a free download. Go over there and check that out, thebootnurse.com/test, and it's also linked in my bio. Also, lastly, I am doing a live NCLEX review this coming Friday, Saturday, and Sunday. You can spend 3 days with me. We're going to be breaking down NCLEX style questions. We're going to tell a story about what the NCLEX is, how the NCLEX grades you, what they test you on, and we also talk about test taking strategies, right? Also, you guys get my ebook, something totally separate from my free download, which is over 700 pages, right? You get access to my 7-day NCLEX course where I have over 80 videos, right? And you also get to be a part of my NCLEX community where I actually do lives. We have challenges and all kinds of great stuff that's in there. So you guys go over there and check that out for yourself. That link is in my bio. And also, if you want to join the wait list for the next live review, it's also linked in my bio. But ladies and gentlemen, hey, I appreciate you. I appreciate you guys hanging out and participating. All right. I appreciate all the love and the likes and all the gifts while they are not recommended or unrecommended, while they are not, what's the word I'm looking for? While they are not, y'all know what I'm talking about. I appreciate them regardless of whatever you guys give me. All right. Usually I block people. I was going to block Erica, but I didn't. I hope she's still in here. She's probably not, but I was going to block her, but I'm not. But once again, I got these questions off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check those out for yourself. Hey, like I said, I'm doing a live NCLEX review. I'm doing one this coming Friday, and I'm also doing one on the 17th to the 19th. Join the wait list. That link is in my bio. The 7-day NCLEX course. Now we went back to a lifetime. All right, you get it, $97. Once you get it, it is yours. Once you get it, it is yours. If you're one of those people that failed the NCLEX, or you need tutoring, you need coaching, you want an ebook for NCLEX, and you want one-on-one time with me for me to help you if you don't understand how to break down questions, if you don't understand content or anything like that, you need accountability, I got you. Check that link. It's also in my bio, all right? So I got about 5 minutes left. And I got about 5 minutes left, man. What y'all talking about? Hey, how y'all doing? Hey, what questions y'all got? What questions do you guys have? I know I got like tired eyes right here. I'm pretty sure I got like a pimple or whatever. But I love y'all. Shout out to all 65 y'all. What we doing? What days do you usually go live? I go live Monday, Wednesdays, and Fridays at 5:30 Central Standard Time. So if you don't live in the US, think of Texas time, Central America. You the man. Sir, I appreciate you. I appreciate you being here. I do these all the time. How many hours should I study a day? Well, that depends. I don't know how many hours you were studying prior. And as somebody who has failed or who was unsuccessful at taking the exam, it's not just about the amount of hours that you're studying. My question is, are you consistent? All right. What are you studying? How are you studying? When are you studying? You know, there's a whole thing to this. Did you pass NCLEX on your first try? I did not. I passed on my fourth try. I passed on my fourth try, and you'll never hear me ever be ashamed of that, ever. You have people that are out here to be like, oh, you shouldn't be a nurse, or maybe you should find something different. Maybe those people should just go away, right? Because if you want it, you're going to fight for it. And by fight for it, that means you're going to put in the work. Thank you for your Navy service. Sir, I appreciate you. Thank you for your support. All right. What other questions do you guys have? I got about 5 minutes. All right. Hey, listen, I failed when it was 75 to 265. I failed at 75. I failed at 265. And I failed at 106 or 105, something like that on my third time. And then the fourth time I took it during COVID and I passed on the fourth time at 60 questions. Is the NCLEX very different from nursing school exams? Yes, it very much is different because nursing school exams are all about memorization, right? But when you get the NCLEX, it's all about the critical thinking. So I give you the content, I give you the basis of what is happening. So if we start talking about diabetes, you know that people that have diabetes, they're going to have that nursing diagnosis of ineffective tissue circulation and stuff like that. So now I need to be able to, if I give you a scenario, you need to be able to recognize the cues that you learn or recognize the signs and symptoms that you learn in school and apply it to an actual scenario of a patient. How much did Hearst help? I never used it. So I used Hearst, but it didn't help me at all. Like it didn't help me at all because it just, number one, it was me. Number two, I had an older version of Hearst before they updated it. And like her accent was just a real distraction for me, right? Everybody loves some Aunt Marlene. If you guys don't know her, Aunt Marlene Hearst is, she's the creator of the Hearst Review. But I feel like Hearst oversimplifies. Maybe it could be. I looked at their questions. I wasn't a big fan of their questions, but what I will say is that I think their content is okay. Oversimplification is not bad if you already have a good understanding of your content. All right. Is Kaplan QBank good? I think Kaplan QBank is good, but once again, you're on a tail end of trying to figure out, like what's the easiest way for me to get back into it? Is it CT Mayo or CTA Mayo? I don't want to butcher your name. All right. You're on the tail end. You're trying to figure out why you failed. Right. So you're trying to figure out, should I do this? Should I do this? What you really need to do is you need to figure out truly why you failed. Right. What's your environment look like? What's your study habit look like? Like, do you not understand content? Do you not understand how to break down questions? These are the questions that you have to ask yourself, because it doesn't matter what review I give you. If you have that same mindset that you had the first time, you're going to fail. You're going to fail. Why? Because that's what happened to me, because I was the exact same way. If you don't change your mindset and improve upon why you didn't do well to begin with, you are going to fail again. Okay? So take a breath. I want you guys to realize, all 82 of y'all, the exam does not determine who you are. I have coached people that have taken it 11 times, 9 times, 20 times. It's irrelevant. All right. Some people have bad test taking anxiety. Some people truly don't understand the content. Some people don't understand how to apply the content to the questions, and few and far and everything in between. All right. So take a breath and realize that this exam does not define you. So now you need to figure out how you can retain the information. So another question I ask you is, what type of learner are you? Are you a read-write? Are you an auditory? Are you kinesthetic? Are you visual? Are you a combination of all of them? What study technique helped you retain information? So me, I am an auditory. I'm an auditory and I'm a visual learner. I'm a combination of all of them. But those two specifically helped me for my NCLEX. Now, Rose, I don't know what your name is, but Rose, it depends on what type of learner that you are. So if you're one of those people that can open up a book and start writing down stuff and you don't get tired and you can retain the information because you're able to put pen to paper, and that's what works for you. For me, for Kevin, absolutely not. I will fall asleep. Don't tell me to read. Look, see them books down there? Don't tell me to read them. They're just there as novelties now, right? So don't tell me to read them. All right. But hopefully that was able to give you guys a little bit more context. But hey, get out of your own way. Get out of your own way. All right. I got to cut it early today. Got some stuff I got going on. But hey, remember, check out everything I got going on. Link in my bio. I'm doing a live review on Friday, Saturday, and Sunday. All right. Friday, Saturday, and Sunday. All right. Make sure you guys check the links that I got going out. I'll check the link out. Cool. Also, make sure you guys follow me on Instagram. We don't know what's going to be happening with TikTok, but still make sure you guys go over there and follow me. Also follow me on YouTube. Yeah, get out of your own way. Love yourself. All right. This exam does not determine the type of person that you're going to be. What time, what? What time, what? My man, Kiko Suave, appreciate you. Appreciate you joining the team, my man. All right. Hey, but make sure you, like I said, you guys take care of yourself mentally. All right. If you can't take care of yourself, you can't take care of nobody. All right. The review on the weekend. So the review starts at 12 noon, 12 p.m. Central Standard Time. And yes, I'm sorry. Yes, it is a paid review. It is not a free review. So I do these free questions right here on NCLEX here on TikTok. But this review is going to really hone in on all of the categories as well as how to understand the questions. Like we're going to spend some thorough time together. We're going to spend some really good time together. So make sure you guys go check that out. And if anybody's interested, it's $197 for the review for 3 days. And also you get the replays. You get the live replays for the review. All right. As well as my ebook, as well as being part of the community, as well as the 7-day NCLEX course. You get all that. All right. And we go through all of that. And it's both for LPN and RN as well. All right. LPN and RN. Remember, Jennifer, I don't know how long you've been in here, but what I was saying is that LPNs learn the same content that RNs learn. You learn the same content that RNs learn. You need to understand your scope of practice, what you can and can't do, what you can and cannot accept. You don't take stable patients. You don't initiate blood. You don't do the first assessment. However, you do an assessment to collect data in order to either document or report it up to the RN. You see what I'm saying? So what's up, Quinn? How are you? All right. But hey, I got to go. I got some stuff I got to handle. Make sure you guys follow me, turn that notification on, check out everything I got going on. And it says, how long will the review last each day? So if you jump on to my to that free download, everybody gets that. So each day, first day is going to be about 6 hours, or it's going to be 6 hours, and then Friday and Saturday Saturday and Sunday it's going to be 8 hours. Yeah, Bella, you missed it. It's okay though. Have a good night. You have a good night as well. So like I said, all that stuff is inside of the email. Make sure you guys go over there and get that free download, because people that get the free download are the ones that get the email. All right. And also I'm doing another review on the 17th to the 19th of May. If you jump onto that wait list, there's going to be information that I'm going to be posting. Those are going to be the first people to know. What is the difference between the NCLEX RN? I just said it. It was scope of practice. That's what it is. Can you get what? Quinn, can you get what? I swear you better not say nothing stupid. You better not do it. You best not do it. You're welcome, Jennifer. No problem. But yeah, the review works for both everybody. RNs and LPNs. But all right, y'all. I will see everybody on Wednesday.